I want to talk to you about something that's probably been bothering you for a while because I know before I figured out a few things, it was really, really bothering me. You're doing all the things. You're eating right, you're moving your body, but your energy is like all over the place. All over the place. Your blood sugar feels wonky. Your blood sugar feels like a roller coaster. Maybe your blood pressure has changed. Maybe your doctor mentioned something like metabolic syndrome, cue eyeball roll. And it felt like just another thing that you needed to be scared of and not educated on because they don't give you an explanation. And let you in on something. Here is what nobody felt like they needed to mention. And for those of you who've been around for this series, you're going to get it. Estrogen is playing a role here, a direct role. We have estrogen receptors in all parts of our bodies, if you haven't figured that out yet. And estrogen plays a direct role in how your body handles insulin, how your blood pressure is regulated, how your cells produce and use energy. So when estrogen starts to fluctuate in perimenopause, your entire metabolic system is going to feel the shift. So for those of you who are beating yourselves up about, lack of willpower right now, let's reframe that and understand that this is very much right now a hormone story. All of a sudden, one day, it felt like I woke up and I was holding weight around the middle, starting to feel like I had a protruded barrel belly, which maybe I had when I was obese, but I don't recall it looking the way that it did. And I was mortified. I am a personal trainer. I have 2 master's degrees almost. I'm almost done with the second one. I've studied food, nutrition. I have all these personal training certs, all these things. And I was like, and I know food. And yeah, okay, I did some, waving in and out of different ways of eating, but whether it was keto or paleo or low carb or whatever, I toyed with all different kinds of things, even intermittent fasting. And nothing was working. And there's nothing more frustrating, in my opinion, when you're doing the work, you're not seeing the results, and at a certain point, I think it might just be really easy to give up. So this is episode 17 of my 82 Symptoms of Perimenopause series. Today we're going to close out the remaining metabolic symptoms. 4 of them, all connected, all part of the same story about what happens in your body with your body's energy. How your energy regulation system changes due to estrogen. Okay, first let me do my best to explain what is happening. Estrogen has receptors in the cells and tissues that handle glucose, which is blood sugar. And it helps those cells respond properly to insulin. Insulin is a hormone, did you know that? And it lets glucose get into your cells to be used as energy. So when estrogen is present and stable, the system works like a well-oiled machine, very efficiently. But when estrogen starts fluctuating, girl, hold on. First, it's called perimenopause, and your insulin sensitivity is going to decrease. And your cells are not going to respond to insulin as efficiently as they had in the past. And glucose is going to stay in your bloodstream longer. And your pancreas is going to try to compensate and produce more insulin. And over time, this big picture becomes insulin resistance. I'm sure you've heard of that. And insulin resistance, if left unaddressed, increases the risk of type 2 diabetes drastically. At the same time, estrogen has, bear with me on the word, vasodilatory, I don't know. Put the word here, Max. Effects. And it helps keep blood vessels flexible and responsive. And as estrogen declines, those effects diminish. And your blood vessels become less elastic, which is not desirable. And blood pressure regulation is less stable. And your blood pressure can rise in ways that have nothing to do with sodium intake or stress. And cortisol. Cortisol is elevated chronically in a lot of women who are in perimenopause. Great, right? Partly because of sleep disruption, and also, again, partly because of the hormonal environment itself. And guess what? Chronic elevated cortisol drives that abdominal fat accumulation and worsens insulin resistance. So you have estrogen dropping, cortisol rising, sounds like astrology, and your blood sugar regulation is getting hit from both directions at once. So, insulin resistance in perimenopause is driven by estrogen fluctuation, not just diet and exercise. Save this and send this to the person who needs a lifesaver, and also maybe send it to the person who just doesn't get it or just don't engage. And blood pressure changes, those are driven by the loss of estrogen's vasodilatory effects, not just lifestyle. These are hormone mechanisms. Hormone mechanisms. All right, on to the 4 metabolic symptoms. 4 symptoms, all connected. We're going to walk through them one at a time. Blood pressure changes. Estrogen's vasodilatory, there we go, effects, meaning its ability to keep blood vessels relaxed and flexible, decline, shocker, as estrogen does what? Declines. The result is blood pressure that becomes less than stable and can trend higher. And women who have had consistently normal blood pressure their entire lives sometimes see it change in perimenopause with no other obvious explanation. And I experienced that. Even when I was running and I was going in and having my blood pressure checked, and normally when I run and lift, my blood pressure is really low. And I noticed that my blood pressure was just incrementally increasing. All right, number 2, insulin resistance. Wah, wah, wah. Your estrogen decline reduces insulin sensitivity in your cells. And guess what? All throughout the body. The pancreas compensates by producing more insulin. And this creates a pattern of higher circulating insulin, blood sugar spikes and crashes, my least favorite, increased fat storage, especially around the abdomen, and over time, elevated risk for type 2 diabetes. And insulin resistance can be present for years, y'all, before it's going to show up on a standard glucose test. Fasting insulin is the most sensitive measure. All right, number 3, blood sugar dysregulation. The practical experience of insulin resistance. Energy crashes after meals. I hate that. Particularly after high carb heavy meals. Sugar cravings that feel urgent and almost compulsive. The afternoon slump that requires caffeine to get through it. Brain fog that you notice is worse at certain parts of the day. These are blood sugar fluctuations, and they have a hormonal driver in perimenopause. They have a hormonal driver in perimenopause. 4, metabolic syndrome. Have you heard that one from your doctor yet? This is the clinical diagnosis that gets made when you have a cluster of metabolic risk factors that appear all together. Abdominal fat, elevated blood pressure, elevated fasting blood sugar, insulin resistance, low HDL cholesterol, and elevated triglycerides. So the risk of metabolic syndrome rises significantly with the menopause transition. And having 3 or more of these markers together at one time significantly increases your risk for cardiovascular disease and heart disease. Cardiovascular disease is heart disease. So it significantly increases your cardiovascular and diabetes risk. It is not an internal flaw for you. It is a hormonal transition and has metabolic consequences. Okay, so fasting insulin is something that you need to ask for from your provider, not just fasting glucose, because insulin resistance shows up in fasting insulin years before it shows up in blood glucose. And most standard metabolic panels do not include fasting insulin. So, if I've taught you anything, speak up, advocate for yourself, and ask for it specifically. All right, so what actually helps? Let's get into it. Number 1, and I'm sure you've heard a lot of hype about this, but it's actually really important, is protein. Protein at every meal. Protein blunts the sugar spike and crash when you eat carbs. It supports muscle mass, which is something that we lose as we begin to age in perimenopause. And it helps improve insulin sensitivity. Oh, and it helps you feel full longer, which reduces the cravings cycle. And most women in perimenopause, let's be real, are eating way less protein than our body needs. I try to consume 1 gram of protein per ideal pound of body weight, which is 160. So it's 160 grams of protein. I find it very complicated some days to get that in, but I'm also on a GLP, which also is a big contributing factor to that. But if you're not on GLP, you don't need 1 gram. I think it's 0.7 gram per pound of body weight, ideal pound of body weight. All right, next, reducing refined carbohydrates and added sugar. Would it be ideal to cut it out completely? Sure. Do I believe it's possible? Sure. Is that realistic? Maybe not for all of us. And I'm not here to try to convince you of that. There are healthy carbohydrates, fruits and veggies, your sweet potatoes, tubers, those kinds of things. Those are slow digesting carbohydrates, not like a cracker or a piece of bread. Now, you don't want to eliminate carbohydrates unless that's your jam, but reducing the refined ones can cause the biggest improvement because you begin to affect the blood sugar spikes and crashes, which I don't know about you, but I hate those. That's the quickest way to turn me into a bitch. So focus on whole food carbohydrates that have fiber, not the processed ones. All right, next is eating in a time window. There's emerging evidence that sticking to a time-restricted eating style is going to support insulin sensitivity and metabolic function in perimenopausal women. It's not about extreme fasting. A 10 or 12 hour eating window, meaning your last meal and your first meal of the next day are approximately 10 to 12 hours apart, is a reasonable starting point. I know that fasting has had a very large amount of positive benefits for a lot of people I've seen do it. It is not for everybody. Go do your research. Go check out Dr. Mindy Pell's Fast Like a Girl. I have that book. She also does Fast Like a Girl Journal and the Menopause Reset. All her books. Love her. And she's got oh my God, her podcast. And she's on YouTube. All right. So now moving on to things that you can do physically is movement. Resistance training is going to improve your it's going to improve your insulin sensitivity directly. Muscle tissue is where a large portion of glucose gets used. More muscle mass means more efficient glucose disposal. This is one of the most evidence-backed metabolic interventions, and it costs nothing. Assuming, of course, that you have things you can lift around your house, or you've got a gym membership. You know what I mean. Post-meal walks are seen to be very advantageous. Even a 10-minute walk after eating has documented benefits like blood sugar regulation. It doesn't need to be intense, it just needs to happen. And then you have treatment options. If insulin resistance or metabolic syndrome is confirmed, this is the part of the conversation where your provider needs to happen. Addressing the estrogen and progesterone environment is directly relevant to metabolic function. Hormone therapy in the right context improves insulin sensitivity, which is really cool, and reduces metabolic syndrome risk in perimenopausal women. Documented. Now for blood pressure specifically. If it's elevated consistently, that warrants a medical conversation with your doc, but bringing the perimenopause context into that conversation absolutely matters. Treating your blood sugar with medication without addressing the hormonal environment is like treating a symptom without looking at the root cause. So remember, hormone therapy improves insulin sensitivity and reduces metabolic syndrome risk in perimenopausal women. This is documented and almost never talked about or discussed or presented to you as a patient. So let me tell you something. Your metabolism isn't broken. It just needs some love and some help. It's literally just responding to the hormonal environment that is going on inside of your body that you were not told about or given a map for or anything. That is a significantly different story than the one most of us have been telling ourselves. So the next episode, we close out the final remaining symptoms in the 82 symptom series. Headaches and migraines, and oh, how I loathe those. Suicidal ideation, breathlessness, and changes in taste and smell. These are the ones that have not had their own dedicated space as of yet. So drop me a comment. Tell me, have you dealt with blood sugar changes, energy crashes, metabolic syndrome, and nobody has connected the dots there for you with estrogen and perimenopause? I want to know, because we need to have these conversations. Like I always say, the more you talk to me and the more I talk to you, the more we're all going to learn the stuff that we need to learn. Again, nothing I share here is medical advice. I am not a doctor. I am a coach. I am a holistic nutrition student who is a mom of two and a woman just living through this in real time. Do your own research. Find a provider who listens. Take what resonates, leave what doesn't. And girl, if you have not done something to love yourself today, please go do that. And if you don't know what that looks like, send me a message and I'll help you out. All my love. Until next time.